I have the kind of family that always opened their doors to other people. It wasn't uncommon for an aunt or an uncle or a cousin to be sleeping on our couch or sharing a room with us when I was growing up. And when I went away to school, I took much of this open door policy with me, and I would host Friendsgiving, or what I called Sunday family dinner, for all of my friends. As I learned more about social justice and health inequities, I translated this open door policy into an open arm policy when thinking about things like caring for those who are underserved or in need. Sometimes this presented itself in ways like me Venmoing a homeless person because it's Easter. No one was surprised in residency when I really loved prison clinic, or that I took a movement disorder fellowship at Boston Medical Center, which is the largest safety net hospital in New England. And for those of you who aren't familiar with the area, it's situated on the corner of Massachusetts Avenue and Milnea Cass Boulevard. And it has been given the nickname of Mass and Cass, which largely represents the big population of people experiencing homelessness and those who suffer IV drug addiction that live on that corner. And knowing this, when I finally took a job as an attending physician, my mother said to me, "Stephanie, whatever you do, please don't take home someone who doesn't have a home. You cannot keep them all in your house." And she wasn't far off. It's estimated that about 25% of people who are admitted to Boston Medical Center actually experience some sort of housing insecurity. We are uniquely situated across the street from Boston Healthcare for the Homeless, and we are very often discharging patients from the inpatient services to the Barbara McGinnis House, which provides respite care for those people too healthy to be in the hospital, but too sick to go back to the street. And so with all of this in mind, it is no surprise that even within a subspecialty clinic of a subspecialty clinic at BMC, or what I call the Huntington's and Ataxia Clinic, you will have some patients who are experiencing homelessness. When Kay first appeared on my schedule with an address of Barbara McGinnis House and a clinical diagnosis of Huntington's disease, I would have put money on her not showing up. She was only a few years older than me, but she had a history of IV drug abuse. She had been on the streets for about 5 years, and she had already no-showed for a lot of appointments in our facility, including in our department. But she showed up that day, thin in a way that I now know Huntington's patients can be, wearing hand-me-down oversized sweatpants and carrying this huge black garbage bag full of everything you can think of to live on the street for a year. Sweatpants, scarves, hats, gloves. And when I went out into the waiting room and I called her name, she took both hands, she grabbed that garbage bag, she slung it over her shoulder, and she had to move her blonde hair out of the way because it got stuck underneath the bag. And she laughed this laugh that I've now come to learn is partially due to her Huntington's disease, partially due to her carefree nature, but always puts a smile on my face. And she taught me a lot that day about Huntington's disease. I was relatively new to taking care of patients with HD, and I had been asked by my division head to start building this clinic, and I was learning still every patient that I saw. But she had experienced her father's illness, and she knew a lot about what she wanted and what she didn't want. She wanted to be in a clinical trial, and those of you who work at Unicure know that not having a home usually doesn't mean that you can participate in a clinical trial. She did not want to be placed in a facility. She was very clear about that, even though I tried to convince her that that would be a stable home that she could maybe then enroll in the trial for. And she really loved those people who were taking care of her at Barbara McGinnis House. And I have to admit that they probably are the best people on the planet. And she showed up every 3 months, like clockwork, unless she was sick, and when she was, she made up those appointments. And over the course of the 2 years that I had been taking care of her, she seemed to get worse over time, her movements becoming more obvious, and our ages seemed to get further and further apart. We no longer seemed to share those common things that we had that first day, like growing up in the 90s or having sisters. As she developed more symptoms, which happens in Huntington's disease, we had to add more medications to her. things like an anti-anxiety medication and a sleeping pill, and eventually a medication that was stronger and more potent to suppress the movements that she was having. Now, one of the realities of being a Huntington's disease doctor is that Huntington's carries a high risk of suicide. And it's something that we always ask about and we screen about. And as we adjust medications, we have to always straddle that line between helping the movements and making the depression or the suicidal thoughts worse. So as Kay stood in front of me and said, I really like my medication, but I feel still unsteady when I walk, which was also obvious by the fact that she could no longer lug that big garbage bag, but instead was wheeling it into my clinic in the seat of a wheelchair every day, even though I tried to convince her to use the wheelchair instead of storing her belongings on it. I gave her the usual spiel about if you experience any worsening depression or you start to have thoughts of harming yourself, please go back down on the medicine and call me. And about 2 weeks went by. It's normally a pretty good sign that people are doing well. And then on a Friday afternoon, I got a phone call from her nurse. She said that there was a doctor at a psychiatric hospital trying to get a hold of me because Kay had swallowed an entire bottle of antidepressants. And my heart sank. This was the reality of being a Huntington's doctor sitting right in front of me. And I frantically dialed that phone number, and Friday afternoon, you're not always gonna get the doctor, but he answered that night, and he said to me, don't worry, she's doing fine. And we put together a plan for how to adjust her medications, and we scheduled her for an appointment with me about 3 weeks out. But I swear I held my breath those entire 3 weeks. Now, it's not always common that I have a little bit of time in clinic to sneak off and grab a cup of coffee, but on the day that she was scheduled with me, I had about an hour before her appointment. And as I stood up to go run to Dunkin' Donuts, the little green circle next to her name lit up to say that she had arrived. And instead of heading straight to Dunkin', I went to the waiting room. And I walked out and I said, Kay, I am so happy to see you. I was so worried. And she laughed that laugh, and she said, I'm fine. And I said, would you like a cup of coffee? I'm going to Dunkin' Donuts. And she said, oh yeah, I love coffee. So I went to Dunkin', came back with 2 cups. And she was standing in the hallway with that wheelchair. And I underestimated how much she would be able to hold this cup of coffee, and I was so eager to give it to her, I handed it right to her. And she stood in the hallway, holding the cup with 2 hands, rocking back and forth, sloshing coffee all over that big black garbage bag full of her belongings. My fellow standing there glaring at me because she had to go get paper towels to clean up the floor. But the joy that that cup of coffee brought her, I will never regret those $3 that I spent, or the time it took to clean that floor, for the joy that that cup of coffee brought her and that perfect moment standing there with her.